All right, guys, let's talk about purple crying. You may or may not have heard of purple crying, and if you haven't, make sure you tune in because this is an incredibly important episode, especially if you're a parent to a new child. Hi, I'm Dr. Amna Husain, board-certified pediatrician, board-certified lactation consultant, and mom to 2 girls. I'm going to talk today about purple crying, and we referenced this in a past video that we did where we reviewed Emma crying in Friends and Rachel's reaction. And not only that, we reviewed what are normal tactics for getting a baby to calm down, what are things that we have to be aware of and be cautious of as parents. And purple crying really goes hand in hand with something called shaken baby syndrome, which is exactly what we're trying to prevent. So shaken baby syndrome is kind of exactly what it sounds like, but it's essentially shaking the baby out of frustration, out of feelings of overwhelm, guilt. These are all very normal things to feel, but it's not acceptable to hurt the baby. And that's where we as pediatricians have to step in and have to advocate and have to make it be known that this is a phenomenon that we want to prevent. Because again, ideally, nobody should decide to shake their baby, right? Abuse their child, but these things do happen. And I think it's really important to educate so that we prevent on these very things. So, purple crying is going to sound a lot like colic. And I know I've done videos in the past on colic. I've done a few on gripe water and colic, hiccups and colic. I'm going to share a few, link them up here if you want to go back and take a look. But when it comes to purple crying, it's an acronym. So let's talk about the P in purple. P stands for peak of crying. Your baby may cry more each week as they start to get older. This is so tough, okay? Because especially, we call it second night syndrome or third night syndrome, when your baby starts to wake up and those crying cues become very evident as they communicate to you their hunger and their sleep needs. But as your baby begins to cry for longer periods of time, for maybe even reasons that you don't know, that can get very overwhelming. And I think it's important for parents to understand when the peak of purple crying occurs. And typically, parents and caregivers seem to find that purple crying peaks at around 2 months of age. By 3 to 4 months of age, it has typically resolved or decreased considerably. Let's talk about the U in purple crying. Unexpected. These crying episodes can come and go. You may not find any identifiable cause. Does that sound like colic? It's very similar. No identifiable cause of the crying. That doesn't make it any less frustrating for a parent. I get it. I have a child who's had colic as well. I 100% understand. When it comes to R, this is the toughest part because your child resists soothing. It seems like nothing you do can help. Now, some children may respond to one of the methods that I've outlined here in one of my past videos, tips for calming a fussy baby. I literally filmed this right after I had my second, and I will say almost every single item on that list was personally vetted by me. Some of them worked, some of them did not. Some of them worked at other times, and some of them stopped working completely. So resisting soothing, I will say, is so tough, especially in the moment, because you're trying to do the right thing for your baby, what you think is the right thing for your baby. The second P is a pain-like face. Now, I don't love this P because who doesn't have a pain face when they cry? Even adults, right? All of us always say, I'm an ugly crier or something like that. Nobody really has the best, smooth, most calm, at peace face when they're crying. But pain-like face is something that they use to make the purple and purple crying, right? We need to make an acronym at the end of the day. So if your child looks like they're in pain when they're crying, which is normal, could also be purple crying. Let's talk about the L. Long lasting. These cries can last for a half hour, an hour. They can stop temporarily and then go right back on for another hour. This is really, really important because I think some parents misconceive how long crying can go on. I mean, honestly, colic is a definition that includes 3 hours of crying a day. Purple crying sometimes states it can be up to 5 hours a day. So that long-lasting cry, it can be a lot. And yes, it can be 5 hours divided up in a day, which is quite literally awful. That's almost 25% of the entire day that they are crying. That's a lot. And the last letter evening. And to add the cherry on top to everything we've said, when it peaks, how it's unexpected, when they resist soothing, how it's long lasting. This all happens typically in the evening. That's what the E stands for in purple crying. And in the evening is when we are at our wit's end. And that is when we've had the whole day. That is when we want to rest, right? That's when our circadian rhythm naturally kicks up and wants us to go to sleep too. There's a lot going on in the evenings, especially if you may have other children. Those children may be coming home from school and may be time to get dinner on the table. Just a lot. So here are my little quips about the evening time that I hope are helpful, especially with my oldest. When my husband would come home, I often was able to pass the baby off at that time. We lived in an apartment, sent him outside with a baby carrier and just told him to walk outside in the hallway. And I'm sure our neighbors hated us. I am so sorry to our neighbors back in DC when this happened. But this was something that helped me survive the night because the whole day she was crying. And I would say that was something that helped us. I do recognize that it was a luxury. I had a partner that I could hand the baby off to, but it was something that helped us in that evening period between like 6 to 7 or 5 to 7. So I could eat something, maybe shower, or eat something, maybe rest, take Tylenol, Motrin, whatever it may be for a migraine that was creeping up, and recharge a little bit of battery for the night going forward. Another thing that can be helpful, and I did this a lot with my second, is to recognize that sometimes you have to bring the baby carrier or the swing or the bouncer, whatever it may be, the rocker, to the dinner table. I literally have memories of my second and rocking her with my foot while trying to have a family meal with my oldest, and have that one calm down so that I could continue and have a conversation and give my oldest some sense of normalcy. I literally also remember bringing that rocker up to the table and putting it on the dining table so that my youngest would feel like she was a part of the family. Like, here, look at everybody's face, and maybe that will help you stop crying. There are a lot of different things that you could do in the evenings. Some of them are walks, some of them are strolls, some of them are white noise machines, some of them are the ones I mentioned, like movement, a rocker or a swing, something to buy you just a few minutes of time. Of course, supervised, strapped in carefully, so that you can eat your dinner or have some normalcy in the evening if you have other children as well. And remember, our goal here when it comes to purple crying is to educate on what is normal and to recognize that we are trying to prevent something called shaken baby syndrome. And I hit on this briefly, but shaken baby syndrome is essentially shaking the baby. And enough so, the brain within the skull is also shaking, and that can be very, very devastating for the child because you're actually breaking some axon connections or nerve connections within the brain. It can cause serious complications, blindness, developmental delay, and even in some cases, death, which unfortunately I've had to witness in residency due to a baby being shaken. These are not minor concerns, these are major, major concerns. And I think, again, educating is our truest first front in helping to prevent this. Same with SIDS, co-sleeping or suffocation risks. No one wants to hurt their baby, but these things do happen, and they happen unexpectedly. And I think it's very, very important that we help educate on this and prevent it. Now, if you have questions below about purple crying, please make sure you ask them. If this video was helpful, give it a thumbs up. I will see you next week. Bye.